So questions of the week, All right, bunch of emails here. Thank you guys that sent them in. I will be sure to go through them. Actually, let's go through a few of them here. What is your favorite sport? That's a tough one. I play professional football, but I love golf, and I love playing golf with my little guy Bryce. All right, here we go. So, question of the week for you guys. Hey, Dr. Bo, can you please tell me what cervical degeneration and or cervical arthritis is? Okay, you ready? Here we go. Okay, so cervical degeneration is this. That is when the bones and the discs of the neck start to shrink down a little bit. Now, why is that important, and why did you probably ask for it? Well, first off, we obviously know that our body is going through changes from the day we're born and obviously to the day that we die. Now, our body in normal adulthood should have a certain curve to it, and on that curve are all of the certain bones, as well as all of the discs in between them. Now, our spine, our whole spine, is kind of what we call our suit of armor. Why? Because it's protecting the nervous system that is within it. Now, things obviously connect to that suit of armor, and those are our muscles. So a lot of times people will go to a doctor, they'll come into me as a chiropractor, and their complaint is of a neck pain, they have headaches, they may have tension, they may have fatigue, they may walk around like this, and they may have to say, well, I have to itch it and rub it all the time, and then they have x-rays, and the doctor says, oh, looks like you have some arthritis, you have some degeneration there. So what is it? Let me grab my iPad here. Drop my water. All right, let's show you a little bit of what's going on here. I'm gonna try to hold my iPad up here so you guys can kind of better see. So let me pull this all the way back. Okay, so we're gonna come into this real quick. So what you're seeing is the front part of the bone of the neck. That thing in the middle is the disc. The yellow portion is the nervous system or the spine. So we're gonna kind of play it here. I think that'll play, yeah. Awesome. So what you're going to see is the lateral portion of it, and you can see all those bubbles, right? Now, what are the bubbles? People ask me, Bo, what are the bubbles? The bubbles are the disc actually dehydrating. So our discs in our body are made up, I think it's like 80% of water. Now, why is this important? And maybe you've noticed this little thing. Have you ever like gone to bed and then the next morning you get up and you get in your car and you look in the rearview mirror and you have to like tilt it up a little bit? Why is that? Well, the body can actually lose up to a ½ inch of height throughout the day. Why? It's because these discs dehydrate. They literally will squeeze the water out of them. So, you know, when we are working with a person, obviously we want to make sure we hydrate the person, as well as we want to create some sort of oscillation or movement in between the bones, and that'll help to rehydrate the disc as well. The body, just so you know, rehydrates the disc at night when we sleep, and there's studies saying that it takes a full 8 hours for the disc to fully hydrate. One more little tidbit about this is that I believe this is one of the major reasons why a lot of police officers have a lot of low back pain, because you know, their sleep schedules are absolutely crazy, in addition to the fact that they're wearing gun belts and everything's like squishing it all down, right? All right, so back to this here. So we have this, we have the bones, right? That's the cervical spine. We have some dehydration in the disc going on. And then what we're gonna see is that the movement in the spine actually starts to become impeded. Now stop right there. Now can you see how the disc, that's the white portion right there, is narrowing. When it narrows enough, the disc will actually push back a little bit, and then you'll start to hit some of those nerves, that yellow portion, and that's what they call a pinched nerve, and that's when you start getting the numbness and tingling that are going down into the hands. Not a good thing, right? Also, what you notice is on the front of the bone, do you kind of see how there's like some growth looking things, like ooh, that looks kind of weird, right? Growing out the front. Yeah, bone's living tissue, guys. So the bone will actually deform, right? Bone is living tissue. This is why people develop bunions in their feet, because the bone is being, you know, is being formed based upon the pressures that are being placed upon it. All right, here we go. Let's go a little bit further. So now what happens is it gets less and less. We have a little bit of movement. Look at how nasty and crazy that thing is building up in there. That is what they are calling degeneration. That is exactly what they call osteophytes in our world, and that is obviously not a good thing. Okay, so what do you do about it? That's the next question. Well, a couple things. As a chiropractor, I want to obviously work with a person to make sure that the bones and the movement in the joint is working appropriately. You know, if it's moving in the right direction and the right range of motion, then we are usually pretty good. I have lots of patients that have horrible looking curves and they don't have the best, you know, they have quote unquote degeneration, but their body is able to move. Why? Because we can keep the joints free and movable. The second thing is that we want to make sure that the neck and all of the muscles that are attached to those bones are also pretty movable and flexible. You know, you see the little old lady that's all like humped up and like their heads are all tilted wrong. Why? Because everything's locked down and all of those muscles in the neck, especially in the front of the neck as well, become very hypertonic and mad. And again, not a good thing. So overall, what is cervical degeneration? Degeneration is when the bones and the discs start breaking down. It deforms the curve, and the worst portion is if it starts pressing on that nervous system and hitting those nerves, you can start to get some radiculopathy down to the hands. What do we do about it? We get adjusted, we stretch, we make sure that the body is moving, we hydrate the discs with good nutrition and lots of water and lots of rest. Have an amazing day, guys, today. Please keep the questions coming. I absolutely love them. I love your feedback, and I look forward to talking to you soon. Bye now.